Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started. Welcome back. You guys have made it to the fourth and final episode in our De-Escalation series. Congratulations. This week's episode is a continuation of last week's episode. So if you did not catch last week's episode, I would encourage you to go back and listen to that one because this episode jumps right into the middle of that one. So I left you on a cliffhanger last week, and this is the conclusion of last week's episode. So definitely go back and listen to that one and then come back over and listen to this week's episode. In this week's episode, we wrap up this series talking about a particular example that occurred in Dr. Kuba's office and how a patient escalated and what we could have done differently to de-escalate that patient. I do hope that you'll enjoy the conclusion of this series, and our hope when Dr. Kuba and I have taught on this, we realize how practical and helpful this subject matter is. So our hope is by giving this 4 different episodes, you've gained a lot of depth in this subject matter and that you'll be able to go and equip your team to artfully deal with de-escalation. So please jump right into this last episode and enjoy. Thanks for hanging with us, and we do wish you the best of luck on de-escalating your angry patients.
Do you have any other examples, or should I say, I'm sure we have thousands, but...
We have thousands. One in particular that I am thinking about, it actually happened on your team with your billing coordinator who's remote. She's not in the office. And so this lady came in and her ex-husband had insurance and she also had insurance. And she came in and said, hey, I want my ex-husband's insurance to be filed as primary. And
she physically walked into the office?
Yeah, it was for an appointment. They were there for an appointment. And so...
Was the ex there, or was just her and the kids?
Just her. Just her and the kids. So she was bringing the kids to the appointments. And
so at this point, she's talking to the receptionist, not our billing person.
Not the billing person. And so the receptionist said, oh, no, it looks like your insurance is primary. And she's like, no, my insurance isn't primary. It needs to be my ex-husband's. You need to file his first, and then you need to file mine. Well, any of us who work with insurance know that isn't how it works, lady. But the fact of the matter is she came in with a very direct request. And the receptionist didn't know how to handle it. She said, oh, well, I'm going to have to get you to our billing coordinator. I'll get her on the phone for you. So
anything, pausing right there, anything to pick on about her and how she handled it or didn't handle it, or?
So unfortunately, I don't know how she handled it, because I wasn't in the office, and the receptionist just said that she quickly tagged Renee in because she didn't know how to handle that. So your receptionist is, I think, fantastic at so many things, customer service. I can't imagine that she did too much inflaming.
She's very neutral, very neutral tone, very much like, okay, yes, ma'am, I hear what you're saying. Let me get our billing coordinator. I could see her handling that well as well.
I can see her. I wasn't under the impression that she was inflamed when she got on the phone.
Now, my old receptionist, the one I keep talking about, like, she would have been like, no, man, no, that's not how it works. No, we need to bill to yours first. No, I can't do that. No, you need to talk to your insurance company. That's what she would have done. And then she would have found a way to be the victim, like, this mom's being mean to me. And
exactly. Yeah. So this lady got on the phone with your billing person and said, I was just trying to tell the receptionist that the primary needs to be on my husband's. Well, the billing coordinator, as we would all do in this scenario, starts explaining why her ex-husband's is secondary and why hers is primary. And the woman got very heated and said, you're not listening to me. What I want you to file my husband's insurance first. So this lady clearly doesn't understand some of the insurance rules. And she started escalating. And one of the phrases that your billing coordinator said set her off was when your billing coordinator said, "I understand." And the lady said, "No, you don't. You clearly don't understand me." And she kind of went off on her situation and why this was a big deal and blah, 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 blah. So your billing coordinator reached out to me right after that. And she was like,
do we know how the call ended? Like, did she?
Basically, she didn't know. The billing coordinator told the patient, "I'm just going to have to look into this and see what I can do." And then she reached out to me. She's like, "I don't know what to do," because she's demanding that it be filed this way. And I'm trying to tell her it can't be filed that way. And so a couple things that I think we need to be aware of here is anytime we've got somebody that's got a very specific request, they are trying to communicate very clearly. This goes back to paraphrase what you're hearing. I hear that you want to, file your ex-husband's insurance first because you feel like his insurance needs to be primary, or whatever the reason may be. I don't even know if she ever got a reason for that request. Then we say, would it be okay with you if I shared some of the insurance rules that they've put on me? Yes, you could. So again, getting that compliance from her, getting that yes, you have my permission to talk about this. And again, she just went straight into explaining the rules, didn't ask her a question, just immediately started explaining the insurance rules, and that upset the lady. Well, then now she's in this angry state where she can't even listen to logic and reasoning, and your billing coordinator and continue to try to explain it to try to help her understand. Well, the lady was past understanding at that point. And I think that's what we've got to recognize in these moments is there are times that patients get to a point no amount of logic is going to sway them. They're emotionally heated at that point, and we have to deal with the emotions to get to the logic. And I think the attempt of your billing coordinator with "I understand" that did it made it worse.
It's
right?
Just words at that point. It's like there's no way you could understand, because if you did understand, you would have done what I asked.
Exactly. So I think in this particular case for your billing coordinator, I would have, and I told her this, I would have just listened, heard her out, paraphrased, and then I told your billing coordinator, I said, "What does it hurt? Is this something that you can actually solve for her? What does it hurt to bill the husband's insurance first?" I said, "What's insurance going to do?" And she said, "They're going to deny the claim and say that it's the mom's responsibility." I said, "Yep." "And then whose fault is it?" She said, "Insurance." I said, "Yep." I said, "We didn't have to fight the battle. We didn't have to fight the battle at all. This is one where we're like, oh, but no, we have to follow the rules." No, we don't. There's nothing illegal about filing secondary without filing primary first.
But then from her viewpoint, was her concern that we're not going to get paid on time? Mm-hmm. Is that? And then now it's creating extra work for herself. Yeah.
Yep. But in this particular case, it's like, if
that one's not worth the battle.
It wasn't worth the battle.
Yeah.
It wasn't worth the battle. And then we can say, let's say that that's our solution, right? So I think the other thing is we've got to really think outside the box. Can we solve the problem? Sometimes it's just no. We just want to say no. And I think sometimes the solution is there, and it's sometimes simpler. We just get so like, well, we have to do it this way, which I understand. We have rules that we have to follow. But sometimes it's just worth going, am I putting up a fight when I really don't have to put up a fight? And to me, this was one that was easily solvable.
So I'm going to have two things here. One, you just commented back on a similar situation that we got an email the other day from our AR person. And apparently, I guess my previous office manager, and I don't know where this came from, and this is where I tend to really bury my head in the sand. Like, you're saying, like, you can't, and if you knew insurance, you know you can't. I don't know why. I know I knew once, like, 12 years ago why, but I don't remember, and I choose not to clog my brain cells with that reasoning between that. I'd rather learn about a dental concept than, that. So, but she was asking, I guess apparently we have some rule in our office that you have to, if the patients do a refund, you've got to refund it back to the exact method or account that they paid from. Mm-hmm. So my manager must have had that from somewhere. Maybe she heard it at a compliance thing, or maybe somebody told her. I can't imagine that came from me, because if I did say that, it was probably back when I didn't know what I was talking about, but I wouldn't know. Like, that's something I truly would not know. So my next guess would be, did you say that? Or, Dwayne Tinker's our compliance guy. Did Tink say that somewhere? Like, I don't know. But for whatever reason, that's been our rule in our office. And so our AR person emailed you and I the other day and was like, well, this dad is getting very upset because he doesn't even have that bank account anymore. And now, but the rule has always been, we reimbursed it to the exact wherever they came from. And so my response, before you even replied, because I'm just like, oh, ain't nobody got time for this. Like, it doesn't make sense to me. Yeah. Pay him back however he wants to be paid back. I don't care. And I was like, as far as I'm concerned, pay it to wherever he's asking. Then her next question was, and then I think I did say, well, you could wait for Bethany to reply because I'm just doing whatever's easiest. It may or may not be legal. I don't know. But to me, it's common sense. Like, let's all move along. And I would be very agitated if I was the patient. So this is what I was saying before. If I could put myself in the shoes and I'm calling an office, I've got a million things to do and I got to find this office, try to get to the AR person, finally go through all of this. And now you're telling me you can't give me my damn money back. Mm-hmm. What is wrong with you? Are you being shady right now? Give me my damn money. Like, that's what I would be thinking. And so that's the other part of smelling the smoke signals. If you yourself would be upset or your spouse would be upset or whatever, then that's where we kind of need to approach some of these. And so then I said, well, ask Bethany, because there might be a legal aspect to this, but as far as I'm concerned, like, send back the check. This is not worth the battle. Then her next question to me was like, do I need to have him come pick it up? Because we used to not send a check through the mail because if it got lost, and then do we have to send it certified? I'm like, but I get checks in the mail all the time, from people who owe me checks. Like, I was like, just send him the check. And I was like, I almost put, get it out before Bethany gets back to you. Like, I'm just ruling on this and go, ask for forgiveness later, dude. But then I think you chimed up and you're like, what is that rule? And so neither one of us can remember now why we have this rule.
No. And if it is a rule, and again, I freely admit in there, I'm like, maybe because your former office manager was uber on top of everything compliance. And I'm like, I could be totally missing something here. But it goes to that rule of thumb. If, as the patient, would I be frustrated by this? Heck yeah, you're telling me you're going to send it to my old bank account and then that bank will send me a check? That's insane. And I think we've got to be able to pause and go, is this really worth the fight? Should we just bend on this? And sometimes we're so angry at the darn patient by that point that we're like, no, we're just doing it this way. We're just to stick it to them. Well, okay, then you've picked your battle. And to me, you're not attempting to de-escalate at all. You're attempting to inflame at that point. And I feel like we've got to be able to figure out when to bow out and do the right thing.
So in that same vein then, I want to go back to the original example because I wanted to talk about this then and I forgot. So could that be where the patient's complaining about the perio maintenance? I don't want to pay the 25, 40, 60, whatever it was, copay. Because I know there's a bunch of dentists out there that are going to go, just write it off and move on. This is not worth the angry review, the board complaint, the angry patient, the telling their 10 friends about how we scammed them, even though we didn't, but that's how they view it. So, because I've had a colleague that's his response to everything. I'm just going to, nope, no charge it, give the money back, do whatever, write it off. And I'm like, that's dangerous territory. So I know we talked about this a couple of episodes ago, but can you talk, in this particular example, would you think that writing off this perio maintenance for this angry perio patient is the prudent thing to do in this case? Not at all.
No.
Okay.
The reason being is he was genuinely confused on what the difference between a periodontal maintenance was and a prophy. He thought it felt like the same thing to him. In every aspect, he thought it felt like a regular cleaning. So if we took the time to truly de-escalate and then explain those differences to him, and also we can add in the layer of there's a lot of rules from insurance that we have to abide by. And once you've been diagnosed with periodontal disease, we really have no other option. We have to code it this way to be legally in line with what an insurance says.
Could you tag in the insurance company, or is that a dumb way? Like, should you tell them to call their insurance company, or is that asking for more trouble than it's worth?
I honestly feel like this man could have, if we would have handled that situation correctly, I think he would have de-escalated and it would have been a non-issue. We wouldn't have had to tag in insurance, and we would not need to do any kind of write-off. So most of the time, in my mind, the write-off comes in as the last straw. Like, we've tried everything else to de-escalate, and we don't know what else to do besides this. To me, it should be something that's rarely done. If we're good at de-escalating, we will not have to write off a lot. If we're poor at de-escalating, we're writing off way the heck more than we should be.
So to me, the write-off, too, is where I stop and go, is this worth it? Is this worth, if I was in the patient's shoes? So I have two examples here. One was a man who came in the other day, and apparently, he's upset at, and so I went back and I looked at it and I'm like, who is this again? Or what is this again? So it took me a minute, and they were in October, and I remember this because the dad, I got referred from an office down the street, and the dad was very adamant, like, my kid's in pain, I want this treated today. Which we don't do same-day treatment for a lot of different reasons, but especially for this kid, case in point, he was young, 4 years old, not very cooperative, and cardiac kid. Mm-hmm. And so I had to go in there and tell him, I hear you. I get that your kid's hurting. I get that this, I get that, but we don't want to, I don't know, can I use Lido with Epi on him? Can I use nitrous on him? I've got to get all these things in place. And so he understood, and he was really good. And I said, let me get that going now. And then as soon as we hear something back, then we can appoint you ASAP. And, at that point, he wasn't giving any pain medicines. He wasn't doing anything. So we coached him through all that. Came back 2 days later. We got the clearance. He was able to get that one tooth. Well, he had one tooth that was abscessed, one that needed a pulp and crown, and the others that had incipient decay, like interproximal. So not super tiny, but not full blown yet. So we had talked to him about IV sedation, and at that point we would crown everything, do everything. Plan B was, if we're going to go for sedation, if he didn't want to wait for the next IV date, or didn't believe in IV, or didn't want to pay for it, blah, 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 that we would use oral sedation, take out the abscess tooth. If the kid was still cooperating, we would address the next one that had that needed the pulp and crown. If we were still doing okay, then we would put SDF on the other two quadrants. Mm-hmm. Well, this kid ends up having that 8 to 10% of angry child syndrome, that paradoxical reaction with Versed. And so I wasn't there. My associate was. He got stuck with this kid going absolutely bonkers. So they didn't. They only got the tooth extracted, and that was that. Well, then they had appointed them to come back in a month to try to put a space maintainer, try to do SDF. And at that appointment, the kid was doing better. Well, it was the mom that brought the kid. And so he was doing better. We got the spacer on, and we SDF'd 3 quadrants, I guess. Even the one that needed the pulp and crown, we're let's just SDF that for now, and then we'll see you back in 3 months. Well, it's not been 3 months now. It's been 6 weeks, something like that. Well, the kid's hurting. So the kid comes back on Friday. Apparently the dad is I'm upset. We just spent this money on SDF, and it's not working. And now, we have to do this crown. And in my mind, I'm well, no, that tooth never needed SDF. It needed definitive treatment. Mom opted SDF that day. And we don't know about the other quadrants because you were here for the toothache on that one side, not on the other. So I don't know if the SDF's working on the other side or not. In the end, I ended up saying, if that's his sticking point, because again, apparently at that point, he was I am fine with IV. I'm fine with crowns everywhere. I just wanted definitive treatment. And I thought that's what we got. And now he's hurting and we're back to this again. Mm-hmm. So it took some time for me to go in there and go, actually, let me walk through the series of events, because I had met him at the very first appointment and he hadn't been back. Then it had been mom at the next couple of appointments. And anyway, so I had to kind of go, okay, this is where we left it. This is what you guys decided because of this and because of this. And if it's the SDF, because in my mind then I'm if it's the SDF that's your sticking point and you're fine with everything else, because our patients are never fine with anything else. They want it the way they want it. And I said, if that's what it is, then the SDF you paid for those quadrants, I'll credit that towards your crowns. Mm-hmm. Which is not really fair to me. because that's not the choice I made. That's the choice you made, your wife made. Regardless, if that's the sticking point, I'll credit it towards. And then he even was like, I'm not worried about the money. It's not the money. It's just, I don't want him to keep being in pain and definitive treatment and all of that. I was like, no, we're on the same page. We wanted definitive treatment too. But the path that threw you and I off track was your son was hurting. And then you add in the medical complication that we had to wait on the clearance. So that's what threw us off track. But you and I both agree that, yes, definitive treatment is in his best interest, and we are ready to schedule you that now. Sounds like you're ready too. Yep. Okay, great. And then we keep going. So I think it was just making sure I understood his question. But the game of operator by the time I got to me was he's upset about this SDF. And if I had just said, take your money back and go, that wasn't really addressing his question. So honestly, now I've said, I'll credit the SDF towards, I didn't have to do that.
Right.
And I'm going to do it because I said it. He's probably going to look for that, but that wasn't his primary point. The other example I have for that was, so this is another kind of a money one and an insurance one. It always goes back to insurance. It always does. It does. But it was a family that, and I've referenced this family before in one of our podcasts over the last year or so, because that's how this family sticks out in my mind. Both mom and dad are doctors. They think they're my friend because blah, blah, blah. But we called them one time for recare. The kid was overdue for recare, and the mom went bonkers. And I think it was her own guilt, like as a physician, and she's always busy and it's hard to get her kids in. And anyway, I think it was her guilt talking because she realized how long it had been. But I mean, that's all we were doing was trying to get you, saying, hey, you're overdue on recare. Do you want to schedule? We didn't have the 6 o'clock on a Friday that she wanted, and she went ape, you know what. So I just give that history to say this woman has been difficult all the time. Like even to get the kids' treatment done previously, it took 2 years. We'd noticed decay, and finally 2 years later, when he's hurting in the tooth abscess, we're having to extract it and we're having to do all these other things. And I'm like, you're a physician, lady. Your husband's a physician. This is ridiculous. I'm sure you guys feel guilty about this, as you should. Anywho, fast forward now. She comes in, we've had to see the kid once on an emergency basis because of blah, blah, blah. We were training. We had a training day. I said, you know what? Just come on in. Don't mind the office. We're all going to be training, but just don't mind us. Come on in. We'll take care of it. So I have gone bend over backwards for this person. In fact, even like 3 weeks ago, she was texting me. Oh, my kid, this. She sends a picture and I respond to it. Do we need to make an appointment? I said, well, I think this is what's going on. Like, let me know if you need this or whatever. Resolve it for her. Oh, you're so great. Thanks. If you ever have a question on GI, I'll be more than happy to answer it for you. I'm like, I don't like you, so I would never ask you. Anywho, she is now the time before. So they were in maybe 3 months ago. And she came in and she specifically said, this tooth is loose. He can't eat. Can you get it out for him? Yes, we can. Are you okay with if I just put the numbing jelly? I don't think we need to anesthetize. I'm going to pluck it out after. He's going to go, for a minute and he'll be fine. It'll bleed a little bit. You remember all that? Yes, I do. Okay, great. That's the whole reason I'm here today. Like, I know they're due for their cleanings, so we added on the cleanings, but that's the reason we're here is because that tooth is hurting him. Okay, so you want me to get it out today? Great. Got it out. Then the mom leaves. She's like, okay, I just wanted to make sure he was going to be good for that. I'm going to work. Dad will be here to finish out their cleanings and get them out of there. They owe $60, $63, something like that. And she's having a little temper tantrum. So my AR person messages me and says, they're ready to be sent to collections. And I'm like, this mom is going to come unglued again, and the embarrassment of all that. But I'm just like, what do I do at this point? What do I do with that? Like, are you kidding me? So do I just write it off? I guess that's my thing. Like, it's 60 something bucks. Is it not worth the headache? Should I write it off? But I'm already inflamed because she has been a B so many times in the past. And this is where you're kind of saying, I'm digging my heels in and going, I could just write this off. But I'm like, no, you've been so mean to my staff so many times. And I don't think it's fair that you have a tantrum when you want to, but you get all these free services via text and all of that. Like, are you kidding me? You're not going to pay your bill? So I guess I'm being one of those where I'm digging my heels in. But
Yeah.
so anyway, I'll tell you what we did, but you tell me, like, what do I do?
Yeah. Well, and again, this one's difficult because, we start asking the question of, do we want this patient still in the practice?
I don't. They're inactivated in our system. They don't get any reminders from us, so she's got to call us.
To me, once we've reached that point and it's like, it's time for this patient, this family to go. They cause enough problems. To me, I tend to be like you in the response of, let's dig our heels in and allow that to, kind of push them out the door. We're severing ties. Let's either we send that dismissal letter and we say, as a courtesy to you, we've written off the $63 balance so that your records can be inactivated, or we're saying, hey, go on to another dentist and, oh, by the way, you still owe $63. Now, we have to ask the question, is there really a chance of them paying that if we're dismissing them as a patient, they already have not paid the bill and we're dismissing them now, what are the odds that they're going to pay it? Very slim. So it's like, okay, well, do we cling to that $63? I tend to think like you. I'm like, well, heck yeah. I'm going to send them to collections for that. I'm going to get that $63. Likelihood is very low anyway. So it's like, are we creating more problems for ourselves? Do we really care about do we need the $63? Or do we not? I mean, maybe we are in a situation where we need every penny. Okay, then keep the $63 and go for it. But chances are we don't need the $63 and it's just our way of being like, no, you will pay this. My thought process is if we're dismissing the patient, as a courtesy, we're writing off the balance and then we just move on from it. And yeah, we lost $63, but also we got rid of a terrible patient in our practice.
So that was my initial thinking. But then, like, what are we writing and saying why we're dismissing you? That's going to be the next hard part of it. And so I started drafting a response, and I was going to have you look at it because, as y'all have heard from history of the podcast, I am not good at writing those. I am very passive aggressive in my responses. That I've gotten better, I think. But, and I kind of put something like, but I was having a really hard time wording it because how do we say, you asked for this service? You're a physician. What makes you think, you guys put a billing code for taking a patient's pulse ox. So you're the same one telling me that I shouldn't bill for something because you didn't know you were going to have to pay for it? Seriously. But how do I say that in a letter without being sarcastic and going, you're a physician, you should know? Like, that shouldn't matter. It's still like, okay, did our office misstep on this? That we didn't, because then again, yeah, did I cross all my T's and dot my I's? No, I don't have a consent form and I didn't give her an estimate either. And so I'm like, okay, well, in my clinical notes, I have all of that, like the verbal, mom wanted this. She scheduled the appointment specifically to get this done. Mom left after the extraction was completed. So it's like, clearly she wanted it. But if she reported this, I'm up a creek because I did not officially get a consent form or an estimate or anything. So that is on me. Mm. So at that point, it's like, okay, am I writing it off because I screwed up? And then the other part of me is like, okay, well, I'm going to put, so I think my letter ended up saying something like that. Like, it seems like, per the notes, you and like copy and paste that part of my note that says like why I didn't get a consent form. It's like this mom gave us verbal consent, verbally requested this. It seems like you don't value the service that was done because otherwise, like, I guess I just didn't know how to say, well, you just don't want to pay for it. So right. I kind of just said, it seems like I had some better wording. I had gotten it. So do you I send this to collections, or do you prefer, we write it off and you find another dentist? Like, which do you prefer? Yeah. And so that's where I left it. And I think I asked you to, fine tune it because who's going to prefer to be sent to collections? So I was like, this is still not, but I'd spent a long time on it trying to just tippy-toe around. The next morning I was thinking still about it and I was like, you know what? No, let us not send a letter. I'm going to wait for them to show up because they're due in a couple of weeks. And when they check in, we're going to ask for this, oh, by the way, you have a $63 balance on your account. And then I want her to state right there, no, I don't. No, I didn't. No, I didn't. And I was like, I want her to be uncomfortable in our office. I want her to have to tell me to my face, you don't think my services were worth it. And then I can say, you're a physician, you know how this works. Like I can say that verbally in
it's
a
so
nicer
much better
way.
verbally than in written form.
Right. And especially when she's texted me twice since about different problems, like, are you kidding me right now? And I was like, she's one of those that can be a bully over the phone, because she has been, but in person. The other thing is she's always in a rush. Me. My schedule. We drove all the way from South Lake. Blah, 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 blah. So I don't think she's going to want to spend time having a confrontation because she doesn't have the time. She wants to get out. She's busy. She's important. And we are just the dentist. So either she's going to pay it or she's going to take her kids and walk out the door. Good. We're in the same way if we sent the letter.
That's right.
So I guess for listeners, I guess where I'm going with this and whatever situations you guys have, I guess I'm hoping you take a look at this and say, might it be worth it to write off? But am I going to get bullied later? Because that's happened to me many a time. Is this the value of, not a value, are we talking about a principle here or something?
Right.
How should we? And then part of the preparation is because now I'm asking for escalation out the wazoo. Like, talk about we're trying to de-escalate. I'm going to have an escalation. But we've made notes. And we've prepped our receptionist. When she comes in, this is what's going to happen. And so that morning, when we see that patient coming in, there's flags all over that. We are all going to have, in morning huddle, we know our strategy and how we're going to. And I kind of want her to escalate and leave. So I'm actually asking for an escalation at this point.
You're inviting it in at that point, which... I agreed with you on this strategy. I feel like it's very wise, honestly, which sounds weird. It's like, why would we're spending this whole episode talking about de-escalation. Why would we invite that into the office? But there is this interesting phenomenon that happens, and we talk about it, joke about it all the time, that patients or parents will just be awful to the staff, right? Just gripe, complain, speak rudely, speak harshly. But when that doctor is there, not always, but most people change their tune and they're a very different person. So I am 100% confident that this woman thinks that you don't even know about the issue. You're oblivious to the fact that they have a balance and that they're about to go to collections. I can guarantee you she's thinking that you have nothing to do with any of this, that she's fighting a battle with somebody on your team and she's being a bee.
How it works in medical. Like it's some random person somewhere off in some collection center that she's being a bee to.
Yep, exactly. And so I think she will be hopefully embarrassed enough and surprised enough by the interaction with you, being forced to talk to you about it, that she will either pay it with an ounce of humility or she will leave the practice completely. And so I feel like the strategy is very important because it's getting her in front of you. And this is somebody who texts you, right? She asks you a question via your personal cell phone. Like this is hopefully going to be something that either sends her one way or the other.
So a lot of that too, it's like you have to know the patient. And now you're weighing out common sense why, like I'm putting myself into all of these situations and going, okay, if I was her, would I do this? If I was her, would I do that? I know she's busy. I know. So it's a patient I have the luxury of knowing in that regard. Do I know her fully? Am I friends with her? No. But in that, she's been coming long enough and I've been reading these smoke signals from her for a long time now. And then we're preparing our team. We will be prepared if and when they show up. And then, I had another takeaway from here. I can't remember what it is right now. But anyway, so like knowing, like being able to read the situation from multiple angles, I guess would be a takeaway.
And I would say that level of preparation, if we could have that mindset for our schedule of patients for that day, it doesn't have to be some extreme example like this. It could be, hey, every time this patient comes in, he becomes very irritated if we don't see him within 5 minutes of his appointment time. Okay, team, what can we do to try to avoid that situation today? And I know that even saying it, I mean, we joked about the medical earlier and how that's laughable that they would even think about that. But man, if we can avoid that, why not do everything in our power to try to avoid that situation? And yeah, it may make it a little bit stressful on the team to do that, but I feel like there's a lot that preparation comes in so much. If we can just look at who we're seeing, look at the potential problems, be prepared for those, and even be solving them before they happen, well, then we don't even have to spot the smoke signals at that point. We've put the water on the fire before it even walked in the door because we had a game plan for it. And I think it's worth doing that.
And I would say this is where for the doctor, it might be a little bit more work for you. Especially if you've had turnover lately, like all of us have, and it's, you've got some team members that are like, oh yeah, I remember that one, or oh yeah, I sat with that one last time. So if you've got newer people, but when you're looking ahead at the schedule, if you can look a day or two ahead even and go, oh, this patient's coming for this, oh, that patient, and then you have your, whoever's answering your phones, leaving good notes, leaving some breadcrumbs in their appointment notes, and somebody's reviewing that ahead of time so that you can pull somebody in and go, hey, I know you're newer here, but this is what this mom is going to say, and this is what I need you to kind of gear it in this direction. Mm-hmm. That's what I was going to say a moment ago when you're saying, is this woman going to tell me to my face? I would be shocked at if it even came that far, because I think just the fact that she's going to be asked in that moment where she's trying to be rushed and now her kids can't come back to get their appointment started because she owes money, she'll probably go, no, I said I'm not going to pay that, or no, I shouldn't have to pay that, or no, I shouldn't, whatever. The receptionist being prepared for that could go, okay, well, I have this note from our billing coordinator, and okay, so that doesn't sound right to you. Okay, so tell me again, and this is where you're asking those questions again. Tell me again, you don't think you owe this balance. Okay, let me get some help, somebody who is a little more clinical that can help you. And then I've got my 1 or 2 clinical people that I know, probably my super direct one, will put her in consult and will say, yeah, these are the doctor's notes. You wanted this. You requested this. Was that not you? Is Dr. Kuba mistaken on here? You know what? She's here. Let me go get her. And she can. So I bet this mom, it will probably 95%, it'll get resolved even before we have to talk about it. Either she's going to leave or she's going to be like, damn it, let me just pay this bill. 5% chance I'm going to even have to talk to her.
That's true. That's a good point.
So I will keep y'all posted, to be determined, because this is our plan for now, and they're still due coming up in a couple weeks, and then this will all unfold, and either the building's going to be on fire, or or my strategy will have worked.
This will be a true trial run here.
Yes.
Real life.
Would
trial
love
run.
to hear what people have to say. So if y'all could give any feedback you guys have, for maybe we could have a part 4 to this series of smoke signals with your staff or with your patients.
Yeah.
We would
Send
love
in
to
your
hear
scenarios.
that.
This is everyday life.
Your scenarios and your solutions, like anything you did to help problem solve these, I would love to have more tips.
I love it. Well, thanks for hanging with us, listeners. I hope this has been helpful. Take this to your team. Train your team on this. It'll be worth every minute of time.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.